Good evening, everyone. My name is Paul Eterno, and I am here at the Vitality Center on 35 Arcade Drive in the Industrial Park in Hauppauge. I want to thank Dr. Jason Pape and his staff for their hospitality and having me here tonight to talk about this topic that I am very excited to share with you folks. This is a topic in healthcare, a subject that I'm going to guess that 95% of our viewing audience has never heard of before. It's called health sharing. When you're thinking about choosing an insurance carrier, if you have a choice, what are some of the things that you think about? Is it price? Is it affordability? Is it freedom to choose your doctors? What's important to you? Those are things you should be giving some thought to. If you're an independent contractor, if you're a gig worker, if you're a small business owner, you 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 are probably priced out of insurance because the premiums are too high, which is a problem for many entrepreneurs these days. But we think that we have an answer to that. We have a solution to that problem, and that's what I want to share with you tonight. So let me share these slides with you here. So what people want most is they want affordable premiums, right? A lot of people are priced out of insurance these days. They want affordable copays. They want affordable deductibles. They want the freedom to be able to choose their doctors and hospitals. If you, God forbid, get cancer or you become a diabetic, you want to be able to go to the best physicians that are available to you. It may be in a different state. It could be MD Anderson in Texas. It could be it could be Columbia Presbyterian in Manhattan. If your plan does not cover that hospital, you're not going to have access to those doctors. So those are important features that you want to have access to when you're picking an insurance plan. Today, the truth is that 80% of the country is trying to lower their healthcare costs, and only 5% of the population is responsible for more than 50% of the annual healthcare spending in the United States. What this means is that most people are overpaying for their health insurance. And this is a shocking statistic. Over 100 million Americans are in some form of healthcare debt. There are 360 million Americans, and almost one third of them are in some form of healthcare debt. What is going on with our healthcare industry? It's broken. It's absolutely broken. And I'm going to show you over the next couple of slides why it's broken and then why we have a solution to overcome that. So as you can see on this chart here, from the year 2000 to 2024, healthcare premiums have gone from under $2,000 a month to over $6,000 a month for a family plan. In a different chart, this pink line at the bottom here is the rate of inflation from 2000 to 2023. It averages about 3% a year. The second line in the middle is family household income, which has increased about 5% a year over the last 23 years. But look at the health insurance premiums, how they've gone up. They've averaged over 12% a year for the last 23 years. Some additional statistics. Most medical debt today is now from those people that have insurance, which is hard to believe. How could that be? That 58% of those that are insured account for the medical debt in the United States today. Hospitals are having the most difficult time with debtors that are insured. And that number was only 11% 5 years ago. It's gone from 11% to 58% over the last 5 years. So things are not getting any better. And if that doesn't raise an eyebrow, look at this. How Cigna saves millions by having its doctors reject claims without reading them, which is criminal. It's criminal. Over a period of 2 months last year, Cigna denied over 300,000 claims. Doctors spent an average of 1.2 seconds on a file. And that's according to internal documents. And Cigna insures over 18 million people. It's crazy what's going on in the insurance industry. And then you've got the CEOs that are raking in $45 million a year. The top 7 CEOs made a total of $280 million last year. They're averaging over $40 million a year in compensation. And then everyone wonders why healthcare premiums are going up and why we have medical debt to the extent that we have it. So what I want to talk to you about tonight is an alternative, a cost-effective alternative that provides comprehensive care and is member-centric. It's not insurance. It's called health sharing. Health sharing has been around for 40 years, but no one's heard of it until now because we have such a problem in the healthcare industry. Costs have gone through the roof. People are being priced out of insurance. People are getting themselves into medical debt because carriers are not paying claims. They're denying claims. But health sharing is a solution that we think can solve all of that. And that's what we want to talk about. So I'm going to share with you a slide on that basically gives you an example of how health sharing works. Oh, excuse me, bear with me one second. That's not it. There we go. Okay. This is an example of how health sharing works. This is sharing.
That's different.
Thank you, Division. Bear with us. Sometimes things I'm streaming on.
Sorry about that technical difficulty, folks. Here we go. Okay.
One thing, Paul. Sorry. Just have to put the, You're on slide 9, right? This one?
Yeah.
Okay, and then
Okay, so anyway, what you saw there is a community of people helping someone in need. In traditional insurance, the insurance company is the one that's paying the claims. But in the health sharing model, it's the members within the program that are sharing in paying the medical bills of the other members in need. And that's the big difference here. Health insurance companies are not paying claims is not their primary goal because they are for profit. So their goal is to make sure that their shareholders are happy and that their executives are being paid handsomely. And then come the claims payments. With Impact, Impact is a not-for-profit organization. They have no profit motives. All of the premiums go toward paying medical bills. And that's the major difference. They're very member-centric. That's what we want to talk about now. So who is Impact's targeted customer base? Well, it's individuals and families who are fairly healthy or generally healthy, who are currently paying a portion or all of their healthcare costs. Small business owners, small businesses with 49 or less employees, self-employed, independent contractors, entrepreneurs, gig workers, part-time workers, those that might be underinsured. They maybe got a plan off of the portal, and it's just a catastrophic type plan where they don't have a lot of coverage. Those with no insurance at all. There's a lot of people out there, especially small business owners, that are just priced out of health insurance for both themselves and their families. Those who are overpaying. There's over 90 million people that fall into all of these categories. So there's a lot of people that are looking for a solution. And I believe that Impact has that solution for you. Health sharing has been around, as I mentioned, for over 4 decades. It started in churches many years ago. They provide low monthly costs, more affordable than traditional insurance, and they provide negotiated rates for medical and pharmacy services. Impact specifically is the most modern and contemporary form of health sharing. Previous versions of health sharing were on a reimbursement basis. You would have to go to the doctor, say you're a cash payer, ask for a cash pay discount, get that claim form, submit it to the healthcare carrier, submit it to the health sharing carrier, and wait weeks and even months to get reimbursed. Impact has solved that problem, and I'll get into that a little bit more in a little bit more detail. Previous versions of health sharing had a religious requirement. You actually had to make a profession of faith to be a member. Impact is agnostic with regard to religion. Providers get to bill Impact health sharing directly. That's the big difference. Providers can now pay Impact electronically and bill Impact electronically. They have an EDI number. They have invested the money to be on every single clearinghouse across America, and they have an EDI number, electronic data interchange number, that all the provider needs to do is put that number into their billing system, and Impact will show up as commercial insurance. Question?
So they come in, I see them, and I send the bill to the insurance company, and the insurance company says, okay, so it's deductible. Can they also then send it to the health share if they have both?
A coordination of benefits. It's one or the other.
So they can't use one to support the other one.
Right.
Just like, hey,
Right. Right. The only way that works is with those that are 65 and older. Impact Health Sharing has a senior program where Medicare is primary, and then Impact picks up anything that's covered by Medicare but did not pick up.
Okay.
So, yep. And last but not least, Impact does something that no insurance company does. They negotiate medical expenses on your behalf, and they are using AI-powered reference-based pricing to reduce every single medical bill that they receive by an average of 70%. But that's okay. That's okay. So that mainly applies to hospitals and larger claims. That's where that comes in. They will not do that with you, Dr. Pig. They will not do that to you. And let me give you some examples of that. Let me show you some examples of reference-based pricing. This is a medical claim that came in to Impact. It was a $5,700 bill. Impact took that expense and reduced it by $5,100, leaving $620. Now, this member had not met their deductible, or what we call a primary responsibility amount. So they were responsible for the entire balance, or $620 out of a $5,700 bill, which isn't bad. Yeah, sure.
So the provider in this case has agreed to negotiate with Impact like they would do any other insurance company?
Yes.
Okay.
Yes.
So does everyone have to be enrolled with them, or they just have to sign? If someone just walks in, doesn't matter what insurance, hey, I'm Impact. They have to decide whether or not they're willing to take that.
It's like the opt-in negotiation kind of.
No, Impact, if the provider decides to balance bill the patient, Impact will still negotiate that bill with the provider. And if the provider does not give in to the negotiation, Impact will pay that bill. Impact has said that they will never have a member
In this
be
case,
responsible for balance billing.
in this case, the balance bill, that provider in this case that will take the 620.
Yes, yes.
But they don't have to do it. Unless, is there like a network? Or like?
There's no network. That's the beauty of this plan. There's no provider network.
Right. So
They're on every single clearinghouse. So you can go to see any doctor you want to see in the United States and use any hospital or lab in the United States or any other facility
Right,
for that
but
matter.
based on that, really it's up to the whims of the provider whether they want to accept it.
Let me tell you why the providers are like this.
I'm just asking.
This is all an education process. This is a brand new, this concept has been around for 40 years. Impact's only been around for 5,
Right.
but they're growing faster than any other health sharing company. They're growing by 100% month over month with their members. And let me tell you why the providers are enjoying this is because number one, they're getting reimbursed within 18 days, number one. Rather than, how long does it take? 30, 45, 60? Yeah. 18 days on average, they're paying within 18 days. And number two, they're paying a little bit more. They're paying between 130 and 160% of Medicare rates. All right. And the credentialing for anyone that wants to be a credentialed physician with Impact takes 30 days. They do it within 1 month. Doesn't take 7 or 8 months.
Right, so I'm sorry.
But you don't need to be a credentialed doctor.
What's the benefit?
You would be a preferred provider. They would actually, you'd be on their network. You'd be on, not their network, you'd be on their website, and they would steer people towards you.
Does that mean like we can't?
You do negotiate with them. When you go through your credentialing process, you agree on fees.
Oh,
You agree on fees. Yeah, you agree on fees. Yeah. So here's another example of reference-based pricing. This was a gentleman whose wife had surgery up in Bridgeport, Connecticut. The bill came to $37,600. Impact negotiated that bill down by $23,600. Oops, sorry, $23,600, which left $14,015. Impact shared that bill at 90%, and they had met their primary responsibility amount or the deductible, so they were only responsible for the 10% of the $14,000 or $1,400. Next up, here's a family where twins had their tonsils taken out on the same day. One bill was for $65,000, the other bill was for $46,000. Don't ask me why there was that discrepancy or that differential, but Impact negotiated the $65,000 bill down by $58,000, which left $8,400. $5,700 of that was 90% covered, and they only had to pay $641 out of a $65,000 bill. On the other son, same thing, $46,000 bill reduced by $40,000. They had met their primary responsibility amount. $5,100 was shared. They had a bill of $570 left. That's the power of reference-based pricing. Impact looks, feels, and works just like insurance, although it's not insurance. But I want to show you how it looks just like insurance. This is a membership card. This card looks just like a regular traditional insurance card. On the front of the card is the primary member's name, their membership number, their household member's number. You've got an 800 provider services number, member services number. You've got your pharmacy group number, BIN number, and PCN numbers. You've got your provider fee schedule here. And then on the back of the card is a provider 800 provider number. You've got the EDI payer ID number, which is the number that you provide to the billing department at the provider. They put that number in their system, IH400, and Impact will show up as a commercial insurance. And if they don't want to bill electronically, they can always mail the paper bills into Impact. Why they would want to do that is beyond me, but
So that's the code.
yeah, the 50, the 75, 50, yeah, 50 to 75.
Is that standard across the board, or is that-
That's standard across the board. Standard across the board. So what does it take? What do you do when you have to go to the doctor? Let me show you an example of what you do when you go to the doctor.
Is really easy. All the information that your provider will need is found right on your card, so be sure to show your Impact card at every visit. Now I bet one of the reasons you joined Impact was because you could see any provider you choose. You were surprised that there were no networks or limits on providers with Impact. Sometimes providers are too. If your provider says they don't take Impact, here are a few things to say. Keep in mind, most providers will ask for your healthcare information when making your appointment, and it is certainly easier to walk through these steps before you arrive. First, tell them that Impact doesn't use a network, but processes bills electronically like any other plan. They just need to add Impact into their system. In fact, show them the EDI payer ID, which is right on the back of your card. The person checking you in may or may not be able to do that. If they cannot, ask to speak with their billing department and explain this again. When you do, be sure to show your card. Another option is for them to mail Impact the bill right to our P.O. Box. This address is also located right on your member ID. You can also give them a copy of the provider instructions, which you can download at impacthealthsharing.com/doctor. Another option, if it is during business hours, is to have them call us. We are happy to help them set up Impact in their system. If it is after hours or they are hesitant to call, you can direct them to the Impact website. We have a section just for providers that introduces them to Impact, shows them exactly how to send us bills electronically for processing. Simply direct them to impacthealthsharing.com/providers. Finally, if the provider is still not able to bill Impact directly after doing everything I just mentioned, get the care that you need. Just confirm that they will be able to provide you with all the information you need to submit your bill to Impact. In industry terms, these are called a HCFA, HCFA, or UB form and look just like this. With all of these educational materials, most providers submit their bills to Impact for processing seamlessly. In fact, most bills are processed in less than 30 days. As always, we are here for you. If we can help you along the way, we want to. Just give us a call.
Okay, so as you saw in that video, it's pretty simple. The issue is, this is an education process for most providers, because many of the providers out there have not heard of health sharing, or they're accustomed, maybe they have heard of health sharing, and they're accustomed to the reimbursement schedule, where, you ask for a cash pay discount, you get a HICFA form, you submit that form, and then you get reimbursed. With Impact, gone, they've solved that hurdle. They have their EDI number. It allows the doctors at all the hospitals to provide to bill them directly, which is a huge hurdle that they've overcome. That's the major benefit. So once the doctors find out how quickly they get reimbursed, no doctors out there, I think from traditional insurance companies, are being paid within 18 days. That's unheard of. So, and cash flow is a major concern for many provider offices. So it's a business just like any other one. So cash flows, accounts receivables are important, and accounts. So let's talk about some of the benefits of Impact Health Sharing. What is it all about? What does it provide? Well, first of all, it's comprehensive care. It covers everything from colds to cancer to transplants. It's gives you the freedom to choose your doctor and facility nationwide. You have nationwide access to all networks. Everyone gets a free annual physical or wellness visit. There's a $150 blood credit anywhere. Special pricing with Quest Labs. They have a relationship with Quest Labs. There are 50 outpatient therapy visits for chiropractic adjustments, PT, physical therapy, occupational therapy, respiratory therapy, cardiac therapy, all outpatient therapies, 50 combined visits. Free telemedicine. We use MD Live. You get free telemedicine. If someone in your family gets sick at 2 a.m, like my daughter did about a month and a half ago, at 2:30 a.m, our phone rings. She's up in Connecticut at school. She calls up at 2:30. I said, Olivia, talk to me. What's going on? I have chest pains. I have chest pains under my right breast. I said, pull out your Impact card, call the 800 number, which she did. In 10 minutes, the doctor called her back. He said, get to the emergency room. She went to the emergency room. She gave the card to Bridgeport Hospital, or St. Vincent's Hospital up there. Everything went smoothly. They took Impact, no issues. And it was nothing cardiac related. It was her gallbladder. But it just gives you that peace of mind, that knowing that you can get a doctor within 10, 15 minutes. You don't have to get yourself out of bed most of the time to go to an urgent care center or the emergency room. So you're saving a lot there. So in addition to that, extremely competitive prescription pricing. It's a wholesale prescription drug plan that beats the GoodRx Gold plan over 90% of the time. Premiums start at $73 for individuals and $378 for families of 3 or more, based upon the eldest person's age in the family. Household deductibles, rather than individual deducticbles, as is the case with traditional insurance companies, our deductibles start at $2,500, go up to $10,000 in $2,500 increments. Free dental and vision discount program as well with this plan as well, at no extra cost. And this is our latest and greatest benefit, a health and wholeness credit of up to $150. If anyone out there uses any of the modalities that Dr. Pape offers at the Vitality Center, you can take that bill or those bills up to $150, submit them to Impact Health Sharing on a monthly basis, and they will reduce your $2,500 deductible by $150 a month, which is a major benefit that no other insurance carrier has.
When they do that, let's say you can't afford whatever. They send you on bucks, or there's.
No, they credit the member $150. They're going to take your invoice, whatever that invoice is, they're going to submit it to Impact, and Impact's going to give them a credit of up to $150. And that credit is going to go against their deductible.
Even if I only charge them $50,
No, they'll take your 50, and maybe they see Mike, and Mike's another 50, and maybe they see.
you can use it throughout any health.
Yeah,
It's not like you use it until it's gone.
yeah. It's a combined $150 a month. Yeah, anything holistic or naturopathic. It could be massages, it could be a gym membership, it could be acupuncture, health, stretch therapy. 150 of it will. What's that? $150 a month maximum will be credited against the deductible. So if you're starting at $2,500 and in month one, at the end of month one, they have $200 worth of charges, they can take 150 of those 200 and put it toward the health and wellness credit and get their deductible reduced from 2,500 to 2,350. Nothing. They just get up to $150 credit. That's it. So it reduces the deductible by $150 maximum each month. So after 4 months, you can reduce your deductible by $600. So you can go from 2,500 down to 1,900, and so on. So you're going to get your coverage implemented that much quicker. No. Yeah, the health and wellness credit is a maximum of $150 a month.
So like, if you go to the MD, it's like $500, that's $500.
Yes.
So
Yes.
there's basically a cap on that.
Yes, that's all. It's just a cap on the credit that you get toward reducing your deductible.
Once you hit your deductible, is there any kind of cap on what they count?
After you reach your deductible, then you're covered at 90%. It's a 90-10
No matter
co-share.
how often.
Yeah, 90-10 co-share. It's a 90-10 co-share. Most insurance carriers are 80-20 or 70-30. This is,
So really, if I'm reading it, limit how much of your health and wholeness goes towards deductible.
no, they're not limiting that at all. They're reducing your deductible. They're reducing it.
But anytime you pay something to the provider, it goes to deductible.
The 500 is going to go, say you had a $500 bill from this office. $500 is going to go toward your deductible.
Right.
But 150 of that's going to get credited toward your deductible and reduce it by 150
So
bucks.
additional.
Yes. No.
So if someone, if you came in and said, oh, no, it's 2,000 plus the extra 150.
Right.
Thank you. Now it makes more sense. I thought it wasn't guiding us. It's not a cap. It's additional. The bonus, right? That makes sense.
It's a credit.
Okay, I was not understanding what you said before. Now.
Yeah, 500 will go toward the deductible. So so
That's
then
why I said, what happens to the extra $50? You said, well, nothing.
it reduces the deductible from 2,500 down to 2,350. Exactly right. Yeah. All right. So what do we mean by a pre-existing condition? All right, because we said that there is a pre-existing condition clause. A pre-existing condition is any medical condition that has known signs, symptoms, testing, diagnosis, treatment, and use of medication that's occurred within 36 months prior to membership. All right. So if you're on cancer medications or if you're on diabetes medications, you're going to be on that probably for the rest of your life, unless you get lucky and you can get off of it. But for most individuals that are on those type of drugs, most people may be on them for life. Some may get lucky because they see Dr. Pape and he heals them. And then they do get off it. And then once they're off it for 36 months, then they may want to become an impact member. But if you feel that you still want to be an impact member, this does not preclude you from being an impact member. It just means that for that particular condition, that would not be a shareable bill. But they will still reduce that bill. If you had a $20,000 hospitalization due to cancer or something else, they will still reference-based price that bill for you, even though it's a pre-existing condition bill. So you still get that benefit. But everything else would be shareable other than that pre-existing condition. All right? That's with any pre-existing condition. Any.
So let's say I'm treating a patient for just generally, like we have I go back to a traditional insurance company. Would that be considered a pre-condition because they're experts and they get treated for that, or
Are they on medication for it?
that's my question. No,
If they're not on medication for it, I mean,
So he's saying like if someone came back in the last 6 months,
Well, it's going to be, a pre-existing condition is going to be based on medical records. So when they look back and see
Right.
that there was
So
a,
anything they treated for in the last 3 years.
yes,
Now, if it's, let's say they, is it doesn't matter as long as anything they had 3 years before we started. It doesn't matter, it's not like, hey, I signed up January 1st, 2025. In January 2024, I had neck injuries, now we're not gonna cover that in that 30-month window. After 3 years, once we hit 2027, could I possibly then file for neck? It doesn't matter.
as long as there's been no sign, symptom treatment.
As long as you have to join, even though you join, as long as 3 years after you join, nothing is billed for that.
Right.
medical treatment, then it can now be covered.
Yes,
Okay, I just want to make sure what you're saying. You have to be joined for 10 years. You have a symptom.
no, after 3 years with,
3-year window.
any 3 years, after 3 years of no signs, symptoms, or treatments or
whether you
medications.
have it or not.
Right.
If you're billing insurance.
Yeah.
Well, if you have medical records.
And so a lot of our patients then would be considered pre-existing for a neck injury or a back injury that wouldn't get any covered, correct?
That's correct. So what I want to do is I'd like to share with you, every member gets a portal. So I want to share with you a portal. This is not a video, so hopefully it'll just, okay. I want to share with you the level of transparency that Impact offers that traditional insurance companies do not offer. There is total transparency with all your dollars, because all your premiums are going into your account. Everyone has an individual account, so you get to see how your money's being spent. Unlike with a traditional insurance company, you just send your premium into the insurance company and it goes into this black hole and you don't know where it's going or what it's being used for. Here you will see the breakdown of how it's being used. So I'm going to go to my portal. And show you my portal. All right. So this is how everyone's portal looks. All right. So let's go to my dashboard. So this is my individual dashboard. So on here, you can see how my monthly premiums was spent for the last 12 months. Let's do year to date. So year to date, $108 went to share with other individuals. $48 went to administrative services, $20 went to account fees, program services, $18. That's how my money was spent that I paid each month for the first 2 months of this year so far. These are my share notice published. $96 is what I pay a month for my senior program. And then you can see each month, October, November, December, January, February, these are the amount of premiums that were collected. This is the amount of administrative fees, and this is what's remaining. So these are the households that I've helped. I helped the Carey household. I shared my premium to go toward the Cates household, the Sunley household, the Roos household, the Johnson household, and the Avila household. So those are the families that I've helped with my sharing. And you can do that on a community basis as well.
You will be on that show. You have to have a show.
Yeah.
That's really cool.
Yep. See, these are the largest needs shared last month. The Peterson household had a $199,000 bill. The Schustella household had a $94,000 bill, and so on. Right here, you see that they're paying bills are processed within 18 days. It's amazing, right? Days to share means to cover a bill to share.
Oh, this is the process. So,
There's 14 days to share and then 4 days to process. 4 days to share, 4 days to share. Right, exactly. And this is nationwide. $32 million in total premiums share portion of that was 16 million, program service fees, 4.9 million, administrative services, 10 million, and other 1 million. So complete transparency is on how all the money is being spent. So,
Well, I have one question.
yes,
Can you remain anonymous, like if you don't want your name posted and published?
sure, absolutely.
I would
Yeah, let me show you some of that stuff.
just drop that.
So here, Paul, you and 23 other impact share members have been matched to help the Cates family, that household, to pay a medical bill of $1,217. Amount of $53 will be deducted from your share account to share in this expense. Why not take a moment and offer a word of encouragement and support? Thanks for sharing. So you can actually send an email to that individual via the portal and wish them well wishes.
He's saying you can't make it so that way. Like, let's say the case family didn't want them to be out there.
They wouldn't do that. Then they wouldn't
It would
put this
say
notice
National
out there.
Help Aid Family or something like
Yeah.
that.
Yep, they would say anonymous
And that's all I would.
automatically. Automatically. Yep.
So Paul, this is not a traditional insurance. Traditional insurance, like the basic sick care.
Yep.
Is there a wellness billing ability? Like, if you came in to see me and you just wanted a spinal checkup, it's not really, not a pre-existing condition, right? Like,
Right.
your spine ever-
Right. That would be covered.
Be healthy, but it won't.
That would be a chiropractic.
Right, do they cover?
Absolutely. Yes.
And because if you've seen me in the last 3 years prior to this, would that be considered?
No.
I just have to say it's a wellness visit, not.
It's a wellness-
It's
It's a wellness visit. Yeah, it's a wellness
You
visit.
will pay a wellness.
Yes. Absolutely.
Adjustment code, diagnosis, what are you about? Right, remember, the diagnosis code is. So the diagnosis, as long as they don't need a diagnosis code, it's painful therapy, which is the adjustment. We have to see.
And that's really all I wanted to share with everyone tonight. I apologize for the technical difficulties, but that's the way it goes when you're doing something live like this, I guess, right? But I do want to share one more slide with you if I can get out of this screen here.
On the bottom, back to,
So let me just want to shoot down here. If you take a photo of that QR code, it'll take you to Impact Health Sharing, where you can get a quote, request information. Oh, I think it's over here.
Yeah.
There we go. Oh. If you take a photo of that QR code, that'll take you to a page where you can actually get a quote for yourself. You just have to input the birth date of the eldest person in your family and the number of people in your family. And you'll get a quote that shows you 4 levels: $2,500 primary responsibility amount, $5,000, $7,500, or $10,000, and then the corresponding premiums for that. Because it's health sharing and it's not for profit, they use different terminology. So instead of deductible, they use primary responsibility amount. Instead of copay, they use co-share. Instead of premium, they use standard rate, but it means the same thing. They're synonymous. So if anyone out there has any questions,
Yeah.
they can call me.
no questions.
My numbers are there and my email's there. But thank you all. I appreciate your time.